Hi everyone and welcome to this week's Facebook Friday. I'm Tracy Allen, Chief Exec, and I'm joined today by Jackie Rawlings, who is our Freedom to Speak Up Guardian. We all know we have probably made more changes more quickly in the last sort of 2 or 3 months than we've ever made before, and that need to keep adapting, working differently as circumstances change is not going to go anywhere soon. We're going to have to learn to live and work in a kind of environment where coronavirus is with us and needs controlling and managing. And in that context, I think when things are changing so fast and life feels really different for every one of us, it's never been more important to have a culture across the organisation where every one of us feels comfortable to raise issues, concerns, have ideas about how we could do things better and where we might be doing things wrong. Now, leaders right across the Trust have put a huge amount of energy and effort into making sure that we've got that type of environment. We've got team meetings, we've got structures, we've got email inboxes where people can raise questions, raise concerns. And thank you to so many of you who have been really, really active about putting your hand up and saying, I don't think this is right, I'm worried about this, so that we can get those things sorted out. But one really important part of the strategy to have that culture where everybody feels they can raise issues, be heard, be safe and get the issues sorted is having a Freedom to Speak Up Guardian, and we are very, very fortunate to have Jackie acting in that role. So Jackie's just going to talk a little bit about her role, and then we were going to have a discussion about some of the key things that have been coming up through the Freedom to Speak Up route around our response to COVID in the last few weeks and months, and some of those issues that are going to remain big going forward. Jackie.
Thank you, Tracy. Yeah, I think in DCHS we've got a really good culture, we've got a really positive and open culture, and there are lots of ways that staff can and they do raise their concerns, and the Freedom to Speak Up Guardian is just one of those routes. Normally people would go through their line manager, they can raise datics, they speak to mentors and coaches, they can speak to any of the executive team. But the Guardian role is somebody who's independent and confidential, where people feel that they need that opportunity to either explore their concerns before taking it forward themselves or having some support in doing that for them. We particularly wanted to speak today about social distancing in the workplace because this is a theme that has come to me over the last couple of months and is something that quite rightly is very challenging. As Tracy has already mentioned, we are going to have to get used to living very differently in the current time and in future times, and maintaining the 2 metre distancing in our personal, our social and our work life is going to be one of those challenges that we need to face. It's very difficult when we're working in fairly confined areas and we come back into a work environment but that feels we've always been in work and we've always worked this way, so to do things differently is very strange. I think also working in the health service, we naturally migrate towards people. That's what we're here for. We're a caring organisation and we're a caring profession. So to keep 2 metres apart from people is really hard. But I'm hearing from staff that they're working really hard on this, but continually finding it difficult. And some of this is due to differing attitudes between colleagues. So people are saying that staff appear to be forgetting, or they don't feel that everybody doesn't put the same sort of priority on it as they do. And even when they challenge people, they feel that that challenge isn't always accepted. So some of the examples I'm hearing are where they're trying to maintain physical distancing in confined but communal areas such as shared kitchens. Maybe they're in there making a cup of coffee, but the next person doesn't wait outside until they finish before they come in. People working in quiet offices or quiet areas to try and distance themselves from others that have to be at base, but other people not acknowledging that it's a small area and coming in and trying to work alongside them. They reference where there are those facilities, maybe there aren't availability of wipes or people aren't using them to wipe down services when they go in and out. And also in shared office areas where colleagues sometimes approach them, look over their shoulder at something on a laptop, or just become too physically close, sometimes even moving chairs that have been strategically placed 2 metres apart to be closer to them. And I don't think any of this is intentional, but it can make colleagues feel very uncomfortable. And it would be really good if we could develop a culture where it's normal to challenge somebody, and you expect to be challenged and you're comfortable with that challenge and your response is appropriate.
We were just talking about that, weren't we, and saying it is about learning to live quite differently. And I've certainly appreciated when people have said to me, oh, actually, Tracy, you know, you can't sit there because it's not 2 metres apart, reminded me about the hand gel, etc. It can feel a bit awkward to begin with, but it's some new habits that we've got to learn. And I mean, Julie and the IPC team have done an amazing job of educating us all and supporting us all. And I was on a call yesterday with the National Medical Director, who was reiterating to chief execs nationally a lot of the things that Julie's been saying to us. The evidence shows now from what we know with transmission that good IPC and the right use of PPE when you're working clinically is really, really effective. So there is very little evidence of transmission from staff to patients or from patients to staff. What there is some evidence of transmission from patient to patient, which is why certainly in DCHS we're now looking in our inpatient areas at how we separate beds more effectively. But the most evidence of transmission is between staff to staff. And the hypothesis is really that whilst people are being incredibly cautious and consistent about IPC when they're working clinically, then, as you say, old habits die hard. They pay less attention because we haven't got used to it yet in non-clinical areas. And that hand and surface hygiene and staying physically apart are the 3 things we can do to slow down transmission. Yeah.
I've also heard that the contact tracing for staff, infected staff, is going to change, and that could have a big impact on our services.
Yeah. So we'd got a question, I think, about the new, what's it called, test and track or test and trace programme nationally, and that I heard yesterday that is going to be launched by the government on the 1st of June. And essentially what we're going back to nationally is where we were sort of February, the beginning of March. So anybody wherever they work who gets symptoms gets access to a test. Once that test result is positive, then they will be contacted. In NHS employees' terms, it probably will be through occupational health departments, but there's also teams of contact tracers nationally, and asked about all the people they've physically been in contact with. Now, if there's 4 of us in this room, so there's Jackie and I today, then we've got a couple of comms colleagues, if actually we couldn't demonstrate that we'd always been consistently 2 metres apart, all of us, if I tested positive today, you 3 would all have to self-isolate with your whole families for 14 days, no matter whether you develop symptoms or not. So we've got to do it to minimise the spread of COVID-19, but there's a really kind of personal, selfish issue is I've got to make sure I stay 2 metres apart from you all to protect me from having to isolate again. I've already done it and I found it really difficult. And from a service delivery point of view, we could have some really difficult staffing issues if actually we've had teams in a dining room. You know, again, nobody's doing this on purpose, but just not remembering to stay separate. Somebody's unfortunate enough to get COVID, then all of those people will have to isolate for 2 weeks.
Absolutely, and that really could have significant issues for some of our service areas and some of our base areas. I think the dining room was a really interesting issue because I was involved in a discussion this week about a dining room in one of our bases where attempts have been made to physically distance it, but people have gone and got more chairs because they felt there wasn't enough and put them back in. And some brilliant measures have been put in that area in very, very quick notice this week. But chairs have had to be physically removed and put out of sight so that they can't be put back in. A one-way system, one in, one out, that sort of thing, being implemented, which is really good.
We're both wearing these new stickers, aren't we? So do you want to just talk a little bit about those?
Yes, so this came as a result of some of the concerns that have been raised to me as well. Where people sometimes feel that their verbal challenge isn't enough, and having something visible, will remind people when they look at it and think, oh yes, but it's also you can indicate to it and just say, I really don't want to be rude, but please can you respect my 2 metres? And we really do need to look after ourselves, our families, our colleagues, as well as our patients at this time. Are you able to explain a little bit more about other things that have been put in place within the organisation and what else is to come?
Yeah, so we've had a couple of questions around that. So if I look at a couple of them, one we've sort of touched on, which is somebody saying they've seen a lot of reminders for staff to observe the 2 metre guidance, but people just don't seem to. And this person says, I feel really uncomfortable about challenging people. And I think, as we've said, this is about, you know, being helpful. It's really, really important. So I think we've all got to be gracious and get more comfortable, try and get more comfortable with when people just give us a bit of a nudge. The infection prevention control team are working with the comms team and lots more comms about it. And we're also re-energising our fantastic network of IPC champions across the organisation and looking at how we can support them to be that sort of super critical friend in working environments around that. So I would say it is in all our interests to be challenged, and certainly I will appreciate it if, until I learn those new habits and learn what 2 metres really feels like, if people feel comfortable to challenge me, and we're putting these things in to help. Another question was about somebody saying that their working environment is cramped, and without knocking down walls, what more can we do? Now there may be some estates changes that we've got to make. We've already been round sites. I think we've put up 26 screens around reception areas, etc. We're putting tape down. But for lots of us, we are going to have to look at how our working environment will change. And as part of our recovery and restoration planning, there's a programme going on at the moment. We've got estates, we've got health and safety, working with Jim Austin, and over the next month going out to individual teams' bases to work with them on what are going to be the challenges. We may need to physically reorganise space. We may need to expand some spaces, so teams that have been in one office may not be able to be in one office. We might have to expand them into others. And one big thing is that we may not, for some time yet, all be able to expect to be in work all of the time. So for those of us who can work from home, we know at the minute the guidance is that we should be working from home. Even when that guidance loosens up, I think we've learned a lot about the advantages of working more flexibly. We know, though, that lots of us, me included, like the social contact in work. We're expecting teams to work over the next sort of month or two on how they could work differently to be able to use the space that they've got in a safe way. So there's a structured process going on. If you've got concerns, looking at every room and working environment, estates are supporting that work area assessment process. And what we would say is there's the health and safety team, there's the estates team, and there's the infection prevention control team. If at the minute you've got anxieties whilst we work through that process, please talk to your manager, and with them call in the experts from those teams who can provide some support in the interim.
There will be a requirement of leaders to do some of this work, because we've got an awful lot of sites and bases, haven't we? So I'm sure the estates team can't get round everywhere, so I think leaders can do some preliminary work in terms of looking at their own areas. I think that's absolutely right. I think that the critical thing is we're looking to estates, IPC and health and safety to come up with the frameworks and help us. There's always going to be some judgment required in this, and again, a call I've been on this morning nationally, they're recognising that even with the national infection prevention control and social distancing guidance that they're working on with us, there will always be a need for local judgment. This isn't somebody else's responsibility. This is every team with their leader's responsibility. That's a really good point, Jackie. What we've got is frameworks to help you, and we're going to have a process to support you through it. And it will require, it's not just about moving chairs, knocking down walls. We're going to all have to think about how we work differently, and our working week might look different for those of us who can work from home sometimes. And leaders really need to lead by example and champion this, don't they?
Yeah.
Because it's very difficult for a team to work from the bottom up and try and do their own thing, but if they haven't got their leaders backing, that's a real challenge as well. So I think that's really important.
I'm really trying. I found it very hard. I go on these weekly video conference calls with loads of other chief execs, and I can see now far more of them are in their office every time when I go on the call, and I'm beginning to feel self-conscious about the fact that I'm usually at home. But the guidance nationally is really clear. If you can work from home at the moment, you should be working from home. And you're right, we need to role model that. We need to be visible and accessible for our teams, but there are lots of ways to do that don't mean you all have to be crammed into a dining room together. Okay, was there anything else you wanted to say about that, Jackie?
There's probably just one other thing that has come to me in terms of the difficulties sometimes for community staff in particular, finding somewhere where they can debrief or have some time out if they've had a particularly difficult day. So I understand that some of the agile rooms are being closed for infection prevention and control reasons. Obviously there's distancing in dining rooms. Staff used to be able to pop into supermarkets to use the toilet and things, which they can't do. So they are likely to come back to base and have a bit of a debrief or just a bit of a time out if they've had a very difficult morning. Because there's less room in their normal offices, they may struggle to find somewhere to go. So I think we just need to bear that in mind as well.
Yeah, and again, I'm pretty sure that community teams and their leaders have been looking at that, haven't they, and doing exactly what you've just advised, which is taking some responsibility to look at, well, how can they kind of commandeer different space at the minute to make sure that they have got areas to do that. We've also got, and it's information is on the wellbeing pages around. There's been some really good work done with the partners in Derbyshire about where people can safely go to the loo. So not just on NHS sites. I think we've got a map of places to change, shower, and just have a comfort break if people need it. Okay, Rob, is there any comments or questions that have come through about that?
Only one quick comment, just from Andrea Rawson, saying that she would imagine most people watching live are actually working from home, so not having to worry about social distancing yet. But I've encouraged to comment on the recording will be posted afterwards, so people, would welcome people to post comments afterwards as well, so we can pick them up.
Okay. Just while we're on the working from home then, one other point. So great, when we're working from home, we're not having to worry about social distancing and challenging or being challenged, can we work safely? But we do know that comes with its own challenges, and actually the longer it's gone on, those of us who have got kids at home or haven't got a brilliant working environment or just naturally extrovert like being in a crowd like me have found it more and more difficult. And we've talked in the last couple of these sessions about how we can support each other, what support is available. Because in our sites, in our big sites, we've had wobble rooms and wobble boxes, etc. We have now got, I don't know if people can see this, these kind of mobile little calm kits, which are the wobble box or wobble room equivalent for those of us who are working on our own or maybe working at home. Logistically a bit more complicated to get all of these out, but I understand that if people now do want to get access to these, those of us that are working from home and feel like they need something to be able to just help them on those difficult days, then these can be accessed via the engagement email address, and we'll make sure that that's up on the Facebook chat before the end of this session. Okay. I've got one other question which is about something different. It's from Helen Foley, who is a clinical practice facilitator at St Oswald's, and she's talking about it's great that we've had all the advice, the posters, the videos, we've got the resources on the COVID page, and I think one of them she's talking about is the standard operating procedures for our community staff or the ward-based or MIU staff. But she's still saying that staff are concerned about inconsistencies in advice around donning and doffing masks in community settings. It's not always possible to maintain safe distance in the patient's home, and there's not always access to bins outside the patient's home. So people are double bagging, transporting PPE, used PPE in their cars. They know it's not the right thing to do, but they sometimes feel they haven't got any alternatives. Is there anything else we can do? Talking about like Daniel's box for sharps. Now, this came in. Thank you very much, Helen. If you're watching, you sent it in earlier. So we did fire it across to Julie Mills, our IPC lead, who is on the session. So she's going to correct me if I get any of this wrong in the chat. But what Julie's saying is that guidance on the donning and doffing, the definitive position, is included within the SOP. And that details that if you're out in the community, donning and doffing does need to take place 2 metres away from the patient. So it should take place in the patient's home where you've got access to hand washing facilities. And I think making the point here that wearing the PPE is really important, but you also have to be washing your hands before and after using it. Staff should hand wash within the patient's home for the final time prior to exiting, and carry hand gels once exited, as they'll have touched the door on their way out. Staff shouldn't be carrying PPE waste in their cars. The only difference in practice in relation to donning and doffing is the additional PPE, mask and eye protection. And I'm not even sure I completely understand that. So I think what Julie is saying is that there are very clear, unequivocal instructions in the SOP, which is very helpful. I think what Helen is saying is that that's great, but sometimes the vagaries of somebody's home, that environment, mean that it's not always possible to work entirely in line with the SOP. I don't know if Julie can shed any more light in the chat on this. What I would suggest, Helen, is that because I suspect that we've not really addressed the nub of the issue that you're raising, which is the practicalities of actually doing this every time with every patient. What I'd suggest is that you contact Julie, and Julie, if you can make contact with Helen, based at St Oswald's, and pick this up. If we can find some other ways around the challenges that you feel you're hearing from your colleagues, Helen, then we can build those into the SOP and get them out in future comms.
Julie has just posted to say the IPNC team are doing team calls. We're arranging them at the moment. We're arranging IPNC roadshows as well. Dates and venues will be coming out soon. Okay,
brilliant. So Julie, thank you for joining at short notice. Could you prioritise contacting Helen, and maybe we can make sure we get a team call with her and her colleagues, but then we need to be sharing this best practice out around the other community teams, because if this is an issue for people around Ashbourne, it's going to be an issue everywhere else. I've got 2 more. Have you got any other questions?
A couple, yeah.
Okay.
Just a comment from Leslie Preston at Cavendish Hospital. Very happy with the efforts of the managers that put in place there around safe working spaces and social distancing. Sharon Hill commenting on the little calm bags, saying she's got hers today. Thank you very much. Alan Blair, is it possible to see what's in the calm kits?
I'll shake it out at the end, Alan.
We'll post pictures on Twitter
Spoil
and
the
Facebook.
surprise.
And I think that's it for now.
Okay, I'll show you the calm kit in a second. Let me just, because I'm conscious of everybody's time, let me just finish up with this. There's one question, one comment actually. So one final question about something slightly different, which is when will we get the antibody tests that have just been announced? So this is really good news nationally that the NHS has purchased what have now been proven to be reliable antibody tests. So this is a blood test. Unfortunately, at the minute, it still has to be done as a proper blood test. That can tell you whether you have been exposed, have had COVID-19. Now, that's really good. At the minute, they're not clear nationally what that actually means, whether the fact that you've been exposed means you've definitely got immunity to future exposure, and if so, for how long. So there's still lots of research and learning going on about that. But what we understand, there's going to be more national announcements made over the next week or so. As far as we understand it right now, what is going to be happening is that any of us that need to have blood tests for other clinical reasons will start to be asked to give consent. For including the COVID antibody test in that. And that will start to build up a picture nationally about how many of us have been exposed. And then for NHS staff, we're expecting that we will start to be given a kind of allocation of tests and be looking at how we prioritise the use of those tests across our colleagues, again to supply information nationally about levels of exposure. I guess they're expecting that levels of exposure within healthcare settings might be higher than within the general community. So the quick answer is we don't know yet when we're going to get access to them. We know that they're there, we know that people are thinking about it, that we will get access in a number of ways through being employed within the NHS, but also if we need blood tests for other clinical reasons, they're going to start tacking that on.
I suppose that could actually complicate our 2 metre distancing in a way, because if
I know.
people feel that they've got immunity and a colleague hasn't, it's like, well, I'm okay, I can come close to you,
Yeah.
I've got this, and it's how do you
Well, I
differentiate?
think that's why we need to really emphasise the message nationally is this test is telling you you've got antibodies to COVID-19. What they don't know yet is whether having antibodies to COVID-19 definitely means you can't catch it again.
Yeah. And could you be a carrier, even though,
Yeah, so it's going to be helpful, but it's a complicated science that is at the early stages. Then the final comment I've had is just a sort of general one really, which is the whole of the UK seems to have reverted to normal. Did you see the pictures of the beach in Southend on Wednesday? Yeah, and actually we've seen pictures locally, haven't we? Dovedale was absolutely rammed last weekend. I think within the NHS, we are certainly still very cautious about being prepared for any second wave that comes from this. It makes it all the more important that we role model the right behaviours. Every one of us is a member of a local community, a member of a family, and anything we can do to role model the right behaviours, to gently remind people of those right behaviours is important. And then with our recovery planning in the NHS, we are still, as I said before, very carefully making sure that we keep the capacity we're going to need if a second wave of the infection gets hold because people haven't been following the right advice. Anything else, Rob? And then we need to wrap up.
No, I think we're good from there.
Okay, well, thank you all very much. I hope that's been helpful. Stickers on their way out, calm kits available. There's a range of self-care products, physical nourishment, healthy and unhealthy, because there's a role for both, and some kind of well-being information and resources in these kits. And I think that often they've been supplied by generous donation from local and regional companies, but we are also using some charitable funds money. We've signed up to be part of the NHS charities and already had our first wodge of that money come back in. So there's some resources being replenished in these kits. But it's a variety, Alan. I won't spoil the surprise, as I say, of kind of self-care treats and then physical and mental nourishment. Thank you all very much and look forward to joining you next week. For those of you not working, have a great weekend. And those of you who are at work, thank you very much.